telephone. Dr. Davis, telephone, please. Dr. Davis, telephone, please. Dr. Blair, Dr. Blair, Dr. J. Hamilton, Dr. J. Hamilton.
Hello, and welcome to Dr. Williams Clinic, where health meets knowledge. I'm Dr. Ola. This week, we are going to be exploring the world of Alzheimer. This video is going to give us a very short and very educative discussion about Alzheimer. What Alzheimer is, its causes, stages, symptoms, diagnosis, and treatments. So let's get into it. What is Alzheimer's disease? To some people, it may be a very new word, but to some people, it's familiar. Why to some people is what they have been living with for a long time. Alzheimer is a neurodegenerative disease that damages brain cells, leading to irreversible cognitive decline. What do I mean by that? It affects the brain and makes the brain duller than it's supposed to be. It's gradual and typically affect people over 65 years, but can also affect younger people in rare cases. Alzheimer's disease is a progressive brain disorder affecting memory, the person's thinking, the person's behavior, and it's the most common cause of dementia worldwide. So, Alzheimer actually causes dementia. What do I mean by dementia? Dementia is actually a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily life. The person keeps on forgetting things, forgetting past memory, forgetting making new memories. It's just affecting the person's thinking and memory generally. So Alzheimer leads to dementia. We shouldn't forget that. Alzheimer is what we are discussing today, which actually leads to dementia. Someone forgetting things, forgetting past memory, forgetting people's face, forgetting their birthday, forgetting almost all they've done throughout their lives. So over 50 million people live with dementia, and Alzheimer alone accounts for 70% of people with dementia. Let's talk about causes and risk factors of Alzheimer. Alzheimer happens when there's build-up of amyloid plaques and tau tangles that damages brain cells. This amyloid plaque and tau tangles in the brain leads to brain cell death. So brain cells start dying off. There is billions of cells in the brain, and when they start dying off, maybe someone that has billions of cells before started having like a million or thousands in worst cases, the person won't be functioning like he or she used to function before. That is exactly what is going on with Alzheimer. Another cause of Alzheimer, or the risk factor of Alzheimer, is age. Like I said before in the introduction, people that are over 65 years old, they are prone to having Alzheimer, but that doesn't mean it doesn't affect younger people. Then we have family history. We have certain genes like APOE4. They increase the risk of having Alzheimer. Alongside its lifestyle factors like diet and physical activity. We also have cardiovascular health, mental and physical health, also prone someone to having Alzheimer. Let's talk about the symptoms and stages of Alzheimer. I categorize this as the symptoms of the stages into three. First one is the early stage. The early stage shows difficulty with short memories. There will be disorientation, trouble with language, and subtle personality changes. Those are the things you will see at the early stage. Those are the early symptoms that you will see. The second stage is progressive stage. This is the stage where the person is into the Alzheimer. You know, this person has Alzheimer. This stage of progressive stage is divided into three, which is mild early stage, moderate middle stage, and the severe late stage. The mild early stage, you will find increasing memory loss, mild confusion, and occasional disorientation. That's for the mild early stage under the progressive stage. The second stage under the progressive stage is the moderate middle stage. You will find that there's greater cognitive decline, more pronounced behavioral changes. There will be repetitive actions and difficulty recognizing familiar people or familiar faces. That is the moderate mild stage. The last stage on the progressive stage is the severe or late stage. There will be full dependency on caregiver, loss of physical ability, and severe memory loss. The person may not remember his own name, his own age, his own date of birth, anything about himself, even how to put on his shoes. The person may not remember how to do any of those. The last stage that I divided the symptoms and the stages to is the behavioral and psychological changes, which depression, anxieties, and the agitation can be seen. It can occur all through any stages of Alzheimer. How do we diagnose Alzheimer? The initial assessment is when the doctor assesses the memory, the problem solving, the language, and other cognitive function of the patient. Then we can do some imaging like MRI, CT scan, PET scan to rule out other conditions. We can do biomarker testing. Can be done using cerebrospinal fluid or blood that can aid early diagnosis. How do we treat and manage Alzheimer's disease? First is medication. There are limited medications to manage Alzheimer. One of them is the cholinesterase inhibitor. The other one is memantine, which can temporarily ease the symptoms but do not stop disease progression. Another way of managing Alzheimer is no drug approach. Includes cognitive therapy, mental stimulation, regular physical activity, and healthy diets such as Mediterranean or DASH diet. DASH diet, I mean DASH diet. Another way of managing Alzheimer is supportive care, such as caregiver support, patient-centered care strategy, and mental health support for both the patient and the family members. The last one I'll be discussing on this video when it comes to the management of Alzheimer is lifestyle tips for brain health. Patients actually benefit from social engagement, learning activities, and physical fitness. When it comes to current research about Alzheimer, It may look discouraging that there's no cure for it, but there are promising areas like immunotherapy, anti-tau and anti-amyloid treatments, and genetic studies that are still going on. We hope for the best so that there will be cure for Alzheimer. In conclusion, Alzheimer is actually a serious condition affecting millions with no current cure. But treatment and lifestyle changes can help manage symptoms. I encourage you, my viewers, to consider joining support groups, advocating for Alzheimer's research, or supporting loved ones impacted by this disease. Don't shy away from helping them. Don't be discouraged. Don't stigmatize them. Help them. They are not doing this to themselves. They need help. They need you time to time. Please be there for them. Also, please share the video to spread awareness. Visit Alzheimer's resources. You can watch on YouTube, on Facebook, or you can reach out to Dr. Williams Clinic for further information and support. Thank you for watching, and be sure to consult your doctor if you have any health or medical concern. Stay healthy, stay informed, and I will see you in the next video.